Good evening, everyone. My name is Nicole Magruder, and I am the Executive Director of Community Hero Action Group. Our mission is closing the gaps in health and wealth disparities in the Black community. I present to you our last session for tonight, and today is Mental Wellness Day, and it is a part of the 2022 Pennsylvania Black Health Matters Conference, Disrupt and Build Up. This session will be led by Shayna Rudd. And the topic of tonight's conversation is suicide and depression in the Black community. But before we start, let me just tell you a little bit more about our facilitator for tonight. Lisa Rudd Winters is a Philadelphia native who was raised predominantly by the strong women of her family. Shayna currently serves as the artistic director of the Legends Academy, a counseling and performing arts school for girls and women. She is a sought-after speaker, counselor, consultant, and performer. As a performer, Shayna has written productions for J. Smith, the Mastery Charter Organization, Alpha Kappa Alpha Sorority Incorporated, and Villanova University, to name a few. Shayna completed her master's in mental health counseling from the University of Pennsylvania in May of 2018. She is now a full-time therapist at the Legends House Counseling Center. Shayna, we are so happy that you are with us this evening. And all the attendees out there, be sure to drop questions or comments that you may have in the chat. Hopefully we will have time at the end to respond to some of them. But I believe that Shayna likes the organic approach. So as they come in, she may address those as they come in. So don't wait to the end. I take that back. All right. So I will hand it over to you, Shayna, and Simone, you will have the opportunity to introduce yourself and talk a little bit about you before we get started. All right. Thank you, ladies, so much.
Thank you. Good evening, everyone. Good evening. Thank you for the lovely introduction. It looks like it's me and you tonight, Miss Simone. We're going to get some work done.
Yeah, let's go.
So,
let's talk.
You tell us about yourself, and then we're just gonna go back and forth with some questions. Mm-hmm. The questions are not organic. I do have them pre-planned, but we are talking about a hard topic this evening, which is suicide in the Black community. And this year specifically, I don't know if you noticed it, especially as a clinician, this topic has been really rising to the surface. I noticed it, namely when Cheslie, who was Miss USA, 30 years old, very successful young lady, died by suicide. And I noticed there was such a rise in the discussion, specifically as it pertains to the Black community. So we're going to spend some time, and that's my daughter, guys. All in the camera. So we're going to spend some time tonight dispelling some of the taboo, sharing, building, and I would love for you to introduce yourself to everyone before we get rocking and rolling.
Yeah. So I'm Simone Golden. I am a licensed social worker and certified coach. My background is in mental health. I have a specialization in health and mental health. I graduated from Temple back in 2009. I currently, I founded a mental health coaching practice a couple years ago, and I focus on Black and Brown communities. So it started because I launched right before the pandemic. So it started just really one-on-one virtual coaching, mental health coaching. And it is turning into more professional developments and trainings. I'm currently finishing a D&I certification for Cornell, and we are looking to kind of expand into, the realm of professional development and helping to, inform whether it's schools or other institutions just around mental health and conversations around mental health. I also serve as the clinical director for a private educational company. So I oversee the mental health services for the facility. It's a K through 12 school. All of the students within the school are diagnosed with emotional support need. And primarily, the students that we serve within our school are Black and brown. So it is, rare that we see and then people can relate to. So part of the reason why I started my organization was because of the experience that I had, working in education and working in schools, therapist. It really allowed me to see that a need that was there. There was a bit of a gap between, providers and our audience. So like everybody else, I've been the person who goes into a doctor's office and other places, and it helps to see someone who looks like you. So part of the motivation for gearing my practice towards the Black and brown community was this idea of being able to have representation within the field.
That's so awesome. And there's so many layers to this, because in the conversation about suicide, death by suicide, suicidal ideations, oftentimes we leave out a very big, large demographic, which is K through 12 children, who we know that in the midst of this pandemic and even before have been experiencing suicidal ideations at an increased level. So, and not to mention those students that are from marginalized communities that are in K through 12 education. So this is awesome. Perfect.
Yeah.
We are so happy to have you. I'm so happy to share space with you. And hopefully tonight together we can team up and really answer questions. The thing I want to say is, because we're talking about a topic that is taboo, we wanted to kind of have like a, how right before a movie is like, viewer discretion is advised. Well, we're going to do a bit of a trigger warning. So if there's something that comes up in this conversation that triggers you, makes you feel uncomfortable, please know that we are here with you. We are a part of this moment with you. Okay, that's number one. Number two, don't feel uncomfortable if you need to step away for a moment, gather yourself, have a sip of water, come back, and then rejoin the community. And I say this as someone who deals with, as I'm someone who is a therapist and also lives with depression, which means I have depressive episodes. If I don't take care of myself, I will be knocked out, rocked. And that's just me being in full self-disclosure. Some of the childhood trauma that I've experienced, I will be, and I don't think for the rest of my life, but I have to work extremely hard at joy, at peace, and making sure that I am not in a space where ending my life is the choice, is the ideal choice. But there was a time when that was not the case. And I shared with the leader of this conference that I was going to start everything with that conversation. The fact that, yes, I am a clinician. Yes, I am somebody who speaks and empowers people. But in 2015, before I had a child, I had what they call a nervous breakdown. Remember people say that in the community, oh, so-and-so had a nervous breakdown. Well, I had what you would call a depressive episode. I cut myself. I don't know, you can't see it because of the lighting. I look at this mark all the time because it was the beginning. It was the beginning of my real work in mental health. And I made a decision in Crisis Center in Abington, PA, that I would, if I got up from here, I would commit to my mental health journey, complete my master's, and begin to work with people, especially women of color, because I feel like there's so much pressure on us, and that pressure comes directly from being enslaved. It's ancestral, the pressure that we put on ourselves as Black people. And there I was, achieving and doing well in the eyes of so many people, but I did not have the tools to say I choose life over death. And so many times my thought was, if I'm not here, then everybody's life will be better. If I'm not here, I won't continue to be abused. If I'm not here, I won't have to deal with all that I have on me. And so now in 2022, it's not an option for me. And so I just wanted to lay that out for you so that you know that you are among family. You are among family. I'm sorry, guys. My daughter is here. Forgive me. So please.
I need your phone.
You are among family. You are among people who love you, value you, and this evening is for you. Okay? So Sorry, guys. I'm trying so hard. I have no support. So I'm here trying to manage my daughter and do this. So forgive me, please. Thank you for saying that. So question number one, and I think are we still only here with one person? Did our second person jump in?
I am still here. I don't know if he's here yet.
Okay. Well, I'm going to move on to question number one. Question number one: how do we define suicidal ideations from a clinical definition? How are we defining suicidal ideations?
I mean, I think it, when people talk about the idea of suicide, I think we'll think about like the final act of suicide, which is death when people follow through and they're successful. But the ideation of suicide is something that is it's the spectrum, right? It could look like a lot of things. It's something that is ever going. It's something that comes and goes. The ideation of suicide is these fleeting thoughts and feelings that we may have, right? It can be something as simple as, I might have a Earth, but do I have a plan or a means to go about that? Maybe not necessarily. So a lot of times when we talk about, and within, even when you think about like the crisis center, when they evaluate you for safety, they look at a few different categories, right? They look at, do you have this thought, right, of wanting to hurt yourself or end your life? But beyond that thought, do you have a means to do that, right? And if you don't have a means and a plan, a lot of times that refers to the ideation. So it's something that might pass through my mind. It might be something that when I have, a bad day, I'm triggered by a particular event, it may cause me in this moment to feel, so low that it passes through my mind like, what if I wasn't here anymore, right? That doesn't mean that I'm necessarily going to follow through with it, but it might mean that, the idea of ending my life has passed through my head, right? I haven't followed through. I haven't sat down and created a plan for it. But the thought of what if is there and kind of ruminating.
So how does a person, or how do we think a person graduates from ideations to planning? And
I think there are.
Go ahead, I'm listening.
There's so many things that factor into that, right? So number one, there's diagnoses play a big part into things, right? So there are a million different diagnoses within mental health, and there are biological factors that play into certain more significant diagnoses. People that may be experiencing, visual hallucinations or audible hallucinations, there are factors that are kind of out of their control that may influence the idea of moving from a thought to an action, right? So if someone is hearing voices that are telling them to do something, then that may influence them a lot more than someone who doesn't, right? But, people who experience some of the, the I don't want to say, lesser, but the more familiar mental health, conditions that a lot of us experience, the anxieties, the depressions, this group of people, there are so many outside factors that can influence going from a thought to an action. It could be something as simple, as a conversation with someone that goes the wrong way. And many times it's not the sitting back and doing a whole lot of planning. It's the in an instant making a decision to go from a thought to an action. A lot of times it's a specific event that will trigger someone in this moment, right, to go from a thought to an action. But there are those instances where, you see people you might see the build up to things. A lot of times, even with, the more famous people now, people are going back and they dig in their tweets to look for little, signs and symptoms of things. But that's not always necessarily telling, right? Because, it's a roller coaster. So people go through patterns of, sometimes you're high, sometimes you're low, sometimes you're on the brink of maybe feeling like that, but you get back to, an even space. So going back and looking at those aren't necessarily indicators. Sometimes they are, sometimes they aren't. But, I think it's really hard. It's hard, especially for family members, when you lose someone to suicide. A lot of times they're going back and trying to look like, what did I miss? Was there something I missed? Was there some sign? Was there something they said? And sometimes it's clear cut, but oftentimes it's not.
I think something that around the time that Cheslie, and you're going to hear me talk about Cheslie a lot, because I feel like that was a turning point for so many people. And for those of you who don't know the story of Cheslie was a 30-year-old Black woman, former Miss USA, and she died by suicide. She leaped from the 29th floor of her building. And it was such a shock to everyone, because now we're going back and we're looking at her IG. Like you said, we're looking at her Twitter, we're looking at all her things. And Cheslie is pulled together. She's stunning. She's got all the things. And there weren't really many cracks in her personal persona. And apparently, as time has, unfolded, her mother and her father have come forth about the fact that she had been living with depression for years. There was an article about her feeling, uncomfortable turning 30, feeling like she just had not, there we go again, I haven't accomplished enough. That imposter syndrome of just like, am I doing enough? I'm not doing enough. Like, and the girl was doing everything, just wearing herself down. And so I think one thing to notice during that time, there was a lot of conversation, even articles written about committing suicide. And there were a lot of, and I read the comments, yes, it's a lovely baby. It is so personal for me because my background is in pageantry. And when Cheslie and her crew came up, we at that time, we had a Black Miss USA, a Black Miss America, and a Black Miss Universe. And I'm from old school. I was one of 3 Black girls competing for Miss America, and told, sew your weave on, because you have to look you almost have to make them think they're seeing a white girl, even though you are Black. And so to see, Cheslie and them come up, it was really exciting for us, but also we felt like we were the bridge over troubled water, the sisters from our era. And so then to see that, she was carrying so much, and there were some mental fragilities, happening with her that were going undealt with. And I see how she got to that point, especially just from the pageant perspective alone. It was very personal, but there was a lot of comments around death, not committing suicide as opposed to death by suicide. And you said something so amazing, which is, I love, because I love us as clinicians that get it, that process of, the final stages of a disease is now suicide as opposed to someone committing it. Can you explain to our viewers the difference and the sensitivity between committing suicide and death by suicide?
Yeah, I think a good comparison is like the age-old comparison of mental health versus physical health, right? We so easily accept that, physical health conditions are things that don't necessarily have a stigma attached to them. If someone has heart disease or someone has cancer, there's this innate level of empathy for them, because, they got it. They have nothing to do with why they have it, and it's out of their control. And there's these treatments that are out there that we could try and they work, but sometimes they don't. And if the cancer treatment doesn't work, then sometimes people die. Whereas mental health has a huge stigma. And within the Black and brown communities, that stigma is even greater, which goes back into our ancestry again, which is a whole nother conversation. But the stigma around mental health, I think, plays a huge factor, into this whole conversation of being able to view suicide as, like you said, the final stages of someone's mental health condition. When we use the term committed suicide, it places a blame of sort on, the individual. It makes it seem like they had a choice in the matter, right? And while we know, practically speaking, you have a choice whether or not to, physically follow through with something, the part that it's really hard for people to understand is that, the mental condition that is fueling those behaviors, right? And it's really even the highest degreed psychiatrist out there who has studied the mind and can prescribe medication can treat a person, but can never truly understand what an individual is experiencing within their own mind, right? So, the top-notch doctors in the world that are treating mental health have lost patients to suicide, and that in and of itself should give you some kind of connection that obviously, if someone has a full treatment plan, the best doctor in the world, the medications that are supposed to work, they're following everything, people, places, and things, just like, who we were just talking about, everything looks great on the outside. What would you possibly not be happy about, right? You have all of this, but the power of the mind, right, is something that is so strong, it can't even really be put into words. And I would challenge people to think about a time in your life where you may have felt not in control of your thoughts. It could be something as simple as, remember that relationship you were in and that guy broke your heart so bad and you told yourself, like, I'm gonna get over it, I'm gonna get up, I'm gonna go about my business, but something comes over you so much that you just can't stop thinking about it. You can't stop, perseverating on these thoughts. It's a weird, comparison, but if you haven't experienced, a true mental health condition, just trying to give you something to compare to that you may have experienced, a time challenging you to think about a time in your life where you may not have fully felt in control of what's going on in your mind. And then multiply that, right, by I don't even know how much, because I'm not in someone else's mind. But, when you ask yourself, how could someone do this? I think it showing some grace to consider the fact that perhaps it was not in their control, right? Perhaps this was something that was so powerful that, it was beyond them. And it's really something that is so difficult to even articulate if it's not something that you've experienced, firsthand. And I haven't myself. I haven't experienced it firsthand. The closest I can say I've come is, after I had my daughter, I feel like I had postpartum anxiety for sure. And I had never experienced anything like that before. It was extremely overwhelming. I didn't feel like I really had control over my emotions. Thankfully, as I kind of got used to motherhood, it passed. But I reflect on that time a lot, when I'm working with people that are experiencing, a mental health crisis, or even, on the other end of the spectrum, with mental health conditions where, it might be an okay time, but there might be little disruptions in their ability to function here and there. Mental health is a spectrum, and that spectrum can go from having a good day to death, right?
That was so to the chat. There are a few questions here. One says, are there any red flags that loved ones should notice so that they can help and support? And when I read that, the first thing I thought of was creating a safe space for all people, from young people to old, to deal with their emotions. I think that's step one. Before we even get to suicidal ideations and someone attempting suicide or death by suicide, I look at it almost, I compare it to cancer. And that's how I think of it in my head. It's like there's stage 1, there's stage 2, there's stage 3, there's stage 4. And I feel like stage 1, oftentimes we rarely find cancer at stage 1. And I think it's kind of like sneaky. And I think that's what depression and high level of anxiety that can give way to depression is like in our very households, with our families, in our communities. And we have a tendency to overlook that. There was this meme going around like, I'm in my room is dirty, I haven't washed in days, and in a Black household, you look like that and you're depressed, but your family says you better get in here and wash these dishes. And just kind of like that, disregarding people's emotions and some signs. So when we're talking about signs in the case, and we keep using Cheslie, yes, everything looked together. But there are people who may not look together. There are people who may not be able to bathe, brush their teeth. You know, they're overeating, they're undereating, they can't sleep. It starts with things like this before we get to the point, I believe at least, where someone is now contemplating death by suicide. We have our other guest here. Hello, so happy.
Hello, ladies. How's everybody doing?
We're doing well. Let me catch you up. We're talking about the question that just was. I want you to introduce yourself, but I want to give you the question first. Are there any red flags that loved ones should notice to help support someone who may be dealing with suicidal ideations? So if you have an answer to that, you can kind of enter the room with answering the question and introducing yourself to everyone.
All right. Well, good evening. I apologize for being late. I was having some tech issues, but my name is Gary Jones, and I'm the owner and founder of Surviving Today LLC. We do therapy with individual therapy, group therapy, family therapy, specializing primarily on anxiety, depression, trauma-related issues, and men-related issues. I do some adjunct teaching at Delaware County Community College, and I said basically I work as a therapist, so that's what I do. In answer to your question, I'm going to say I think the problem with trying to pick up red flags is that you're going to, sometimes we don't pick up the red flags until after it happens, if that makes any sense. So, I mean, things that you definitely want to look for, that I would say look for, would be changes in behavior, especially abrupt changes in behavior. If you got a person that was, jovial, outgoing, and then all of a sudden they become withdrawn, disinterested in doing things. I mean, that could be a sign. Those things can also be signs of depression as well. But I mean, it could be. If you have people that are looking, like people that are giving things away, stuff that was important to them, and they just suddenly start giving things away, those can be signs as well. The big issue with suicide, and especially with completed suicides, that a lot of times we miss that, because a lot of times we see the person where they are, and we're not necessarily thinking about the assessment piece of it, checking to see, have they been depressed? How long have they been depressed? Do they have weapons that are they, what are they saying? Are they saying things that would seem to indicate that they would hurt themselves? So I think there are red flags, but I think the red flags are not necessarily always as clear as we would want them to be. So the reality is that we're going to miss a lot of these. So that's why sometimes, when we see people who are doing well, we're not thinking to check in. But that's probably the moment that we really probably should be checking in, because we've had quite a few cases within the past few months where people have committed suicide, and on the outside they appear to be well.
And I think what you said check in, which I love that phrase. Michelle Williams from Destiny's Child has a book called Checking In. And what I like about the book is that this idea of like checking in, a culture of checking in, so that we're not checking in when it's too late. And not even just the too late of death by suicide, but too late where somebody is hospitalized or someone is, in their home immobile, losing their job, losing a sense of complete self. I think if we have a culture of checking in where we just check in, okay, we are, especially from the Black community, we are a part of a community that has been through more trauma, in my opinion, than anybody. So we need a culture of checking in, period, as a people. Whether someone is showing signs of depression and anxiety or not, just how are you? How are you? And really, and then also creating space for people to be honest. And I feel like that we lack that. We're getting there, but I feel like we lack that. So before we can even talk about red flags as it pertains to death by suicide, I think we definitely need to start with just the bare minimal grace and respect for people's emotions, so that they can have a safe space to unpack, so that we don't get to the point where death by suicide even is a tool or an option for escaping, everyday life. You are so good with popping up with the photo. You are amazing with that. Another question from the group before we dig into some questions on ancestral trauma is, what should we not say to someone who is having suicidal ideations?
Okay.
It's tricky, right? So I tell people all the time, mental health is a very personal thing, and there's someone I'm working with now who has a child that has a mental health condition, and I try to empower her all the time that you are a mom, but you are not expected to know it all. You are not a clinician. You are not someone who's expected to always say the right thing, know the right thing, know what's going to trigger or not trigger a person. My mental health and how I perceive and react to things based on what I'm experiencing and going through is not something that you can predict, right? So something I might say one day that might be okay might very not be okay the next day, depending on what I'm going through, right? So, obviously the blatant things like, I don't want to hear it, we'll go ahead and do it. Those kind of things are things you don't want to say. I think generally, on the other hand, what tool you can arm people with is just the idea of saying, hey, look, being honest, and because many times we don't have the answers, of just saying like, hey, I might not have an answer, I may not know what the solution is, but I'm here to listen, right? And I'm here with you, and I'll help you. I'll try to, whatever I can do, I'm here to help you, I'm here to listen, and we can do this together, right? And kind of not putting the pressure on yourself as a family member or a loved one or a friend or associate or whatever to feel like you have to have a response in that moment. Because rather than responding the wrong way, many people forget that listening is a response, right? Active listening is oftentimes the best response, and oftentimes a lot of times what people need in that moment.
If I could just piggyback off of that, I think what I would say is that we need to let people know it's okay not to be okay. I think we really have to let people know that. And I know that's generally the theme of tonight's discussion, but I think a lot of times people don't think it's okay to not be okay in the moment. So a
Yeah.
lot of times what we do is, we'll say things we mean well, but it doesn't help the situation. Think about a situation where there's a person who, let's say that they've lost a loved one, and what do we say? You know, they're in a better place. We'll say, it was their time, or something. And while we mean well, I think the
Mhm.
problem is what we don't do is we really sort of, what we do is we diminish the person's feelings. We diminish
Yeah.
the impact of the grief and the loss that they're experiencing right now. So what we're saying is that we're essentially saying it's not okay to be okay.
Mhm.
You need to sort of just man up, woman up, whatever you want to call it, and we're saying that it's not okay to experience that change, to really feel how you feel, and then like try to work through it. So I think a lot of times, I don't know if there's any code words per se. I mean, I guess there are some that we could say that we shouldn't say, but I think most of the time it's just our approach. A lot of times, how we approach another person. What we want to be able to do is we want to be able to balance the incident with their feelings. We want to validate a person's experience, what they're feeling, because maybe what what you're feeling, or maybe how you have felt in that situation, is not what they're feeling. So we
Mhm.
need to be there to help folk and understand that, yeah, it's okay. So when we don't let people do that, a lot of times people will pull back. They're not going to tell us how they're feeling. They may be dealing with a whole lot of pressure, but they don't want to tell us what they're dealing with. So they pull back, they keep it in, and then that's when we start to see some individuals that might attempt to hurt themselves, harm themselves, maybe harm other people. You know, so I'm saying those, I think, are some of the things I would say we need to make sure people know it's okay to be okay. We need to be mindful about what we say to other people, period.
Yeah.
And I think
So
so often, I'm sorry, go ahead.
no, I was just gonna piggyback off of what he was saying. The idea of validating, as clinicians, we know we validate people's feelings, right? And some of the core techniques that we use in therapy are things that I often will tell people you can use in those conversations just with your loved ones, right? In terms of reflective listening, right? So if you don't know what to say, if somebody's pouring their heart out to you or saying all kinds of stuff that you're trying to keep a straight face because you don't know how to take it in. A lot of times, just those simple messages like, that sounds like it's really tough. I hear what you're saying. Um, if they're telling you a story, just kind of taking a piece of that story and reflecting back on it, like, so what I'm hearing you say is like that you experienced this and now you're feeling this, so the person can understand that you're hearing what they're trying to say, um and without you having to really give any specific feedback, right?
Mhm.
um the idea of active listening is engaging in the validation of someone's feelings, allowing them to hear that you're here and you're creating this space and that you're acknowledging their experience.
And I think that also many times people have a hard time acknowledging people's experience because it's triggering their own.
Mhm.
So um, I want to quickly get you past this feeling because
Mhm.
I'm
It's
uncomfortable
uncomfortable.
sitting in this
Yeah.
feeling with you. And so
Yeah.
I think what's powerful about active listening is it allows you to to sit there, maybe even feel for yourself as well. But that requires a lot of empathy. And I think
Mhm.
that also requires for us to be very honest about our own triggers. So
Mhm.
perfect segue, because I don't know where we are on time, but we have to discuss how suicide is affecting the Black community specifically. and why we feel like at this time we need to turn our eye to it. Now, I'm not saying that we weren't turning our eye to it 10 years ago. I'm sure all of us are clinicians. We've been hit, to what's going on. We've lived in the house, I'm quite sure, with it, and have had family members that are dealing with it. And we might have called it something else, but it was actually, this. Um, how do we now make Black mental health a priority in our community? Like, how does the everyday person make Black mental health a priority? From the children to our elders, how do we make it a priority? And I think the hardest part, the children might be easier. I think what I've noticed more is my elders, specifically, who were raised in a time period where everything goes under the rug because I don't have the luxury of mental health care. I can't both be Black and dealing with mental health. My grandmother, Shay, rest her soul, she probably would have, they classified her MR. We don't say MR anymore, but she grew up in Jim Crow South, and my great grandmother made a decision to keep her home from school because she was getting rocks thrown at her, apparently, in the South. And they migrated here to Philadelphia. My grandmother never learned to read or write. And so she just was like the slow girl, in the hood. And that was a decision that my great grandmother made for her racial protection. So our elders come from making those hard decisions where they have to choose between, their advancement and their survival. And although we are in 2022, there are still people making those type of decisions every single day, even down to their children. So how do we put this at the top of our agenda, especially as clinicians? And if you have any questions about it, please hop in the chat. This is what we're here for. Yes, I know. This is like my favorite part. It's like my favorite question. I can't wait to hear what you guys are going to say.
So, I have some thoughts. I think, first of all, I think what we have to do is we have to begin to give an ear to what mental health and the education of mental health, what it is and what it means in our community. I think that what we've all alluded to is that hasn't been something that we've done very well. That's been something that we've looked at in different ways. We've sort of diminished it. We really haven't given it the validity. We haven't given it the voice that it needs. So what happens is we've used other things. We've used other things to explain it away. I grew up in the church, so I know, I've heard things. It's that's the devil, or it's the demon of this and the demon of that. And I want to be careful that when I say this, I am not trying to stigmatize. I am not trying to make fun. I'm just being honest. These are the conversations that we see.
Yes.
Every day, every Sunday, every Bible study, and in other places in our community. But what happens is that we don't understand really what it means to be anxious. We don't understand what it means to be depressed. We don't understand the roots of trauma and what it does to us. So, for example, when we're talking about trauma, we need to understand that trauma is one of those things that it impacted you then, and it still continues to impact you today if you're not finding ways to heal yourself. And even when you heal yourself, it still impacts what you do to some degree. So I think there needs to be more of what we're doing here tonight. There needs to be more dialogue. There needs to be more conversation. We need more podcasts. We need more. We need clinicians to understand the need for providing access to education. But I think the other thing as clinicians, what I think we also need to understand, we have to check ourselves, because I am a clinician, but I also deal with some of these same issues. So if I'm dealing with the same issues, then am I taking care of myself? I'm trying to take care of my clients, but am I taking care of myself? So I think that's all part of the education piece that we need to to see more of, hear more of, and it's got to come from everywhere. And that's probably more simple. That's probably more simply put than it is easy to actually put in place. But I think that's where it begins at. It has to be more dialogue, more discussion.
Mhm. Yeah, I think it's so layered, right? So I think on the top tier of things, there needs to be a cultural shift, which I think is happening, right?
Mm-hmm.
Culturally, you know, in the Black culture, whether it's media driven or whatever, um, I think there is this shift to where we're having many more conversations around mental health. Um, it's kind of a cool thing now, right? There's so many more people I know that have a therapist, or are involved in some type of mental health treatment than I ever heard when I was growing up, right? Um, so that cultural shift, I feel like, is important, and that involves those things like, the podcast, the television shows, these types of events, community engagement. But then on the community and familial level, right? So within our institutions, our educational institution, specifically, there needs to be more of a focus on mental health, right? A student can take a class on Shakespeare, right, that may not be important to them if that's not the direction they're going in life, but there's not necessarily a class to talk about how to manage your mental health and coping skills, which is something that everybody's going to need. So thinking about how we can change the conversation and systemically change how we approach mental health and mental health treatment within our educational system, I think, is a huge conversation. I work in education, but it's specifically a therapeutic setting. We need to be having these conversations in traditional school systems. And, school systems where you have, regular kids that are attending school every day, because sometimes, these are the kids that oftentimes just get passed upon because we think everything's fine. They're performing well, they're coming to school every day, everything's fine. And next thing you know, something has happened or somebody's hospitalized, and it's like, what? But what supports do they have? At the family is another conversation, but in the school system, what supports do they have? Oftentimes we have guidance counselors, which when I was growing up, I didn't know. I thought, guidance counselor, that's my counselor. I talk to them, which oftentimes they are people you can talk to, but a guidance counselor, doesn't necessarily have mental health training. Guidance counselors these days oftentimes are trained to prepare kids for post-secondary education, right? They're not someone who is a clinician necessarily. Sometimes they are, but the conversation of having more mental health trained clinicians inside of school buildings to be able to assess, keep an eye on, provide professional development for, keep a pulse on, give resources, be there for families. These are the things that need to be within our educational systems. On the family level, like you were just saying, even about your grandmom and these things, especially in our older generations, there's kind of this idea that you just buck up. When my parents and above, when they talk about the things that they've been through and made it through, right, without having that talk to a therapist, it's like, girl, if you don't stop about your little problems, I done went through the Jim Crow South. You didn't see me complaining about having to go through a therapist, right? So it's this comparative thing, and that's what we have to stop doing, comparing traumas. We can't compare traumas, right? No trauma is worse than the other one. Everybody's trauma, it's a personal thing. So within our own households, we have to really take a look at what the conversation is like. What spaces are we creating for each other within our own personal households, so that people feel, does my partner, does my child, auntie, grandmom, whoever, feel comfortable coming and telling me that they're experiencing this or that. And then just to throw into the conversation, there's this whole idea. I was having a panel discussion a few weeks ago about the idea of of secondary trauma, right? So
Yes.
us experiencing trauma, witnessing the trauma of other people, especially within the Black community. This is something that goes way back to slavery and continues today, especially in this age of media and social media. You know, we are witnessing each other being murdered on television by the institutions that are supposed to be protecting and serving us, and not always consciously understanding how this is affecting us and how this is indeed a trauma that we are experiencing. And we may not carry it with us, and it may not, you know, interfere with my daily ability to function, but, you know, there may be little things that pop up throughout my life or throughout my day where I can associate that with this secondary trauma of me, you know, seeing another story on TV about, you know, some tragedy of, you know, someone that looks just like me, that could have been my brother or my dad or my mom or my sister, just trying to be in the world, living their life, and their life is taken from them, right? Just because of what they look like. So there's so many layers to this idea, you know, around mental health and trauma, and you know, the stigma, I think, around seeking help within our community. It's so deep. It's a conversation that I feel like could go on for days.
And it can. And I think what you both have said is from Mr. Gary talking about, you know, having clinicians have spaces like this, and then also being empowered enough, especially as clinicians of color, to live exactly what we are out here trying to help. But that's so Africana of us, you know, that is in our Africana DNA to take care of everybody and to not take care of ourselves. And then you brought Simone so much clarity as it pertains to just like from the school position to the family position. What I want to add to the conversation is, I don't think we even know our history. And I don't think we realize as a people to the extent of the trauma that is locked up in our bodies just because we are Black. And you know, there's a book called The Body Keeps the Score.
Yeah.
And I truly do believe in you know, and ancestral trauma. That's a big leg in my practice. I do believe that just how we believe in ancestral or what they call them in the church, generational curses, you know, we love to say that. So there are things that are passed down in our bloodline. And even though I wasn't there, you know, to see Emmett Till in his casket deformed, but if my great-great-grandmother was, and that can be passed down from generation to generation. And so I believe that we need to know our stories, we need to know our history, and then we need to because we know it, right? We need to posture ourselves in a perpetual state of self-care and in a perpetual state of releasing that trauma from our bodies, whether that's through movement, through the foods that we eat, through the water that we drink, through the activities that we do. I think that if we understood that, we would posture ourselves in a way that says, I can't participate in certain things because I do not want to bring any more harm to myself or to my bloodline. The fact that critical race theory is an issue and it's a war against it is not just a war against information and education. It is a war against us getting healed. Because the more information you keep from me, the less information I will have about what's actually happening in my body. Excuse me.
Yeah.
So yes, I think that there's a lot of things happening here. I think our grandmamas say buck up because they had to.
Yeah.
We are in a luxurious place. Every time I go to my therapist, I go, dang, this is luxury. Because my mama, she wasn't thinking about no therapy. She was a single mother with a husband that was on drugs. Well, she got to take care of me. I got to go to school. She's not. And her therapy was church. So then you go into the Black church, and no disrespect to the Black church, I'm a product of the Black church. And you hear, if you're depressed, shout it out, dance it out. It's demonic. It's this. And you're trying to pray it away and it's not working.
Mm-hmm.
All of this is a part of our rich history as Black people. And I think that if we had more clinicians armed, give me 1 second, if we have more clinicians armed with history and a love for who we are, we can go in and heal from that angle as well.
Yeah.
Totally agree. I think that I mean I agree with you. I think that when you know your history, then you understand what you're going through. You understand why you're going through it. I mean, I find it interesting. There's a lot of people fighting against CRT on a level that's really doesn't need to be a fight, you know. But
Right.
I think what you guys are saying makes very good sense in the sense of we have experienced so much as a people, you know, from the time that we hit these shores. And I think that history has not really done a great job of explaining what we've gone through. And I read a book, I was reading a book, hold on 1 second. I want to make sure I get the title. Lies My Teacher Told Me. Okay, it's by this guy named James Lowen. And I'm finishing up the book now as we speak. But basically, all of the inaccuracies, all of the things in our history that was not shared, that was not told, that was hidden. And I think that part of what's happening is that now as we start to address some of those aspects of history that we didn't know of or didn't know prior to that, the pushback is that, well, you don't need to know that, or that's divisive or whatever it is. But what it is that that's the piece, that's a part of us. So
Hmm.
it might be, it might be that, say maybe 50 years ago, I mean, you know, our grandparents might have had to go to school through snow, or maybe they had to walk like 15 miles to get to school and maybe 20 miles to get back home. And we laugh at those stories, but today our kids might have to walk 3 blocks and try not to get shot. You
Hmm.
know, so the point I'm making is that the stories might change a little bit, but the themes, if we look at the themes, are still there. We're still in danger. You know,
Hmm.
our kids, when our kids leave and they go out, um, we don't know if they're going to get home. We don't know if some crazy security guard in some private, you know, place is going to think that our child is trying to do something, and then our child gets shot or something. We don't know that, and because of those things, we worry. But then these are the same fears that our ancestors carried in the 1800s, in the 1700s, because you never knew when the master could split up the family, when the master at will could take your child, take you, sell you, beat you, and then still expect you to get up to work the next day. So the trauma is still real. The trauma may have changed over generations, but because it's existed in generations, that's why we have that generational type of trauma that's there. And we have to educate ourselves. We got to understand what that means. And then we got to allow ourselves to really put our voices out there, speak our truths. We have to be able to speak what we're feeling, because what Simone might be feeling may not be what I'm feeling, but it doesn't make it any less valid. So I
Hmm.
think we have to be able to encourage each other to talk about it, to learn our history, and then to grow from it.
Yeah. I think too, it's important that we, bring into the conversation the importance of, increasing the amount of us within the provider pool, right? The mental health provider pool, but also everything else, the physical health provider pool, because it's as important to me. It would be lovely if I could have a Black woman deliver my child, right? I couldn't, because I couldn't find one in my area, but
Mhm.
it would be lovely if we had more of us represented within the provider pool, because there's this barrier that exists automatically when you walk into a provider office and you see someone who historically has been an oppressor, right? And depending on our own personal experiences, some of us more than others might be triggered immediately. I might immediately shut down if I walk in a room and there's a white man there, and they're expected to be my therapist. I think back to when I was I'm a supervisor now, but when I was the clinician working with the kids in the school, it was like a breath of fresh air that, like, there's this black lady here that I could come talk to, that looks like me, that talks like me, that, I feel like understands my vernacular. I don't have to explain what I'm trying to say when I'm talking about certain things. I don't have to worry that they're going to misinterpret something that my parent might have done, that is traditional within our community but not necessarily in others. And the same thing when parents walk into a meeting and are able to see, a black administrator or a therapist, it breaks down that barrier that sometimes exists when we feel like the person on the other side of the table may not necessarily come from the same lens I'm coming from. And that doesn't mean that all black people are the same, that we think the same or see the same or experience the same, but there's a commonality that we all have. Like I always say, that, we have something that we experience that is similar, that we can understand, that you can't even put your finger on. It's that thing that when we're walking past somebody and we see another black person in a room full of white people, you give them a little nod because it's like, I see you, right? And that is so important within these spaces of when we're talking about health, general health, mental health, all of it. Mental health is physical health, right? Our physical health is our mental health. It's all health. It's all as important as the other. And representation within the provider pool, I think, is something that just needs to be a continued part of the conversation.
I can't begin to tell you how often I have seen, on my day job, so many times I've had people ask me, can they be my therapist? And that might have been the first time that they saw me. Part of it might have been something that maybe I said that triggered something that helped, but at the same time, the other thing, most of the times, because I was black, they could identify with me. There there are so many people that come to me and say, I want a black male therapist, I want a black female therapist. I want somebody that will understand what I'm saying. Now, does that mean that every black man or every black male therapist is good? No, that doesn't mean that. But
Right.
but it says something to the fact that we have a longing to want to be heard. If my child is hyperactive, I want someone that's going to listen to me before they decide to give my child some medication.
Yes.
I want someone to be able to hear what is the culture of my particular family, not just not just me as a black person in general, but my family. Well, what is my historical family culture? What have I had to overcome to get to where I am? And the way you see me raising my kids, what is that? I didn't just wake up one day and decide I wanted to raise my kids this way. What led me to that point? So I think we're seeing people, and I mean, Simone, I thank you for saying it. We're seeing people that are learning or want to learn how to voice what they need, and they want people that look like me and you ladies and other folk that we know that can help them and can understand that I'm not crazy. Okay, you may not necessarily have to give me medications during this particular visit just because I told you. Maybe what I'm going through is traumatic. Maybe what I'm going through is something that hurt a long time ago that I didn't realize what I was going through. But now I'm starting. The light is starting to turn on, and I think that's key, because I think a lot of times our therapeutic counterparts miss that. and they become, this is not all of them, but they can become quick to want to, oh, this looks like generalized anxiety disorder. Oh, this looks like, and a lot of times it's insurance driven because we have to be able to give a diagnosis, in a open area type of behavioral situation, so that we can get billed for it, so we can bill for it. So a lot of times those are issues that go into decision making, and but I just think you're right. We need to sit at the table, and if we can't sit at the table, we need to create our own tables.
Mm-hmm.
Absolutely. Absolutely. I know we are over time now, so I just wanted to check in. And this is the last session, but are there any questions from the viewers? If you have questions, please put them in the chat so that we can answer them. If not, do we have any final words? Okay, let's get some final words from our panelists and we can wrap this up. I'm going to start with you, Simone.
Okay. I just want to thank you, guys, for participating in this discussion together, because I feel like it's so important. Like we were talking about earlier, this level of conversation and just presenting more opportunities for people to talk and listen and view conversations like this. A lot of times is the starting point of somebody, being able to say or recognize something within themselves, or, fueling something within someone to say, you know what, maybe I will talk to someone, or you know what, maybe I will talk to the counselor when I get to school tomorrow, or maybe I will share this with my mom or my dad. So, just kind of highlighting the importance of, the continued platforms, so thank you for this platform to be able to even have this conversation, because I feel like, specifically, I'm very, specifically feel very powerful about this conversation within the Black community, because as a Black woman, I have a Black child, I have Black parents, and our unique perspectives and experiences are often invalidated by society. And if no one else is going to validate it, we have to do that ourselves.
I don't know if I can say it any better than what Simone just said, but basically I concur with you. I think that settings like this is so important. We have to be able to sort of change the atmosphere of how we address mental health in our communities. And part of that is by doing what we're doing today. Part of it is by encouraging people to talk about what they're going through. It's okay. It's okay to be okay. I mean, it's okay to not be okay. But at the same time, if you're not okay, let's talk about how we can help you to feel okay. How can we get you from this side to the other side? I mean, that takes the work, but that's part of what it is. And I think that if we can start to do that, I think that's where we start to see some of the healing in our community, or we'll start to see some healing in our community. But I think also we have to keep talking, because there's still so many miles to go. So platforms like this is needed. Platforms like this has to continue. If it's not us three, maybe it's another three. But it's something that can't just stop. We have to continue to talk about it.
Awesome. If there are any final words from me, would just be, if you are here and you are struggling in any way, just please know that this night was ordained for you, that we are here not just as clinicians, but as human beings who are working at our mental health. We just want you to know that you're not alone. If you're looking for a therapist that looks like you have 3 right here. If that's what's in your way, feel free to reach out to us, reach out to someone, talk to someone, and recognize that your life does matter. And I know that oftentimes we don't see that reflected in the world, especially when it comes to Black and brown people. But if you needed to hear it tonight, I'm saying it to you, we're saying it to you, your life matters. And we need you. You are needed. and you matter. So thank you so much to the panelists. Thank you so much for having me tonight. A much, much, much needed conversation. I hope we continue it.
Thank you, Shayna, for leading the conversation.
Thank you. Thank you, definitely.
Hello. Thank you all so much. That was a great conversation. Shayna, you did a absolutely fabulous job facilitating, and I felt like it was very, very, it resonated with me, I know personally. So thank you for your gift. And I appreciate Simone, you jumping in and, agreeing to be a part of this discussion. And of course, Gary, thank you so much. I appreciate the level of expertise and the thoughtfulness of the conversation tonight. And for all of those that are watching out there, as Shayna has said, if you are looking for a therapist, and I truly do believe that sometimes it's very helpful when you have therapists and clinicians that have some of the same lived experiences. It really helps. So you can read their bios, and their contact information is also included with their bios. Just look at the speaker section within the conference, and you can get that information. This is recorded, and we will be sure to upload this. Community Hero Action Group is going to continue these types of conversations. In the conversations that we will be having are more unique and nuanced conversations. They might not be as mainstream or as popular, but they're going to be the conversations that we believe need to take place, even those that are uncomfortable and just may not be popular, because it's affecting us as a community. And we won't get to a better place if we don't really address some of these things that we really haven't been addressing for far too long. So thank you all again. And this concludes the conference for our Mental Wellness Day. Tomorrow is Health and Housing Day. We will be talking about hoarding and understanding your rights if you do have disabilities, and understanding the resources that are there. We'll also be taking a virtual tour of Beaver Farm out at Lincolnall in celebration of Earth Day. And remember, Saturday, if you are anywhere in the Philadelphia, Montgomery County area, to be sure to come out to 1818 Beach Avenue, because we will be having a health and wellness fair out at, it's actually a Farmer John location, but it is a urban farm. We'll be on 1 acre of land. It will be about 30 or so exhibitors and vendors. Fox Chase Medical Center will be out there. Pecan, one of our sponsors, will be out there doing blood pressure checks. Gift of Life, another one of our sponsors, will be there. We'll have a huge inflatable colon out there, because colon health is very, very important. So there'll be a lot of learning going on, free botanical wellness workshops, food, Tai Chi, Zumba, yoga. It's all free. Come out and have fun and convene with the community. It should be a very fun time. That's from 12 to 4, 1818 Beach. So I will close on that note, and I wish you all a very, very good night. Bye-bye.